So I'm the CEO here at Ellenville Regional Hospital. And as you know, we're up to our ears in the COVID pandemic. Last week was our busiest week in my 18 years here in our emergency department. About half of our patients are COVID patients, so we're pretty busy. But an interesting thing, which is what I want to talk about today, is that before the COVID epidemic, the biggest epidemic that we had was the opioid epidemic. And that epidemic has been raging for a long time, and it actually is raging right now and is getting worse. With all the isolation of COVID, it's getting worse. So I'd like to sort of weave in a little story, if you would indulge me a little bit, about Juan Figueroa and our experience with him. So historically, Ellenville Regional Hospital has had little interaction with law enforcement. We do appreciate their rapid response when we have an unruly patient, which occasionally happens in our emergency department. Nothing calms down an intoxicated, obnoxious patient who is being rude to our staff and our nurses, like having a large, burly, crisply dressed sheriff strolling into our emergency department, wondering what the problem is. Usually they calm down real quick. So we appreciate that. And we are also very supportive of law enforcement when they have accidents or they're involved in situations where they may be injured, or they're bringing in inmates, there are people in custody for treatment. But basically, we do healthcare and they do the law enforcement part. So we've basically stayed in our lanes. And that's the way it's been for almost my whole time here. So over the last 7 or 8 years, Ellenville Regional Hospital has been working to fight the opioid crisis. We developed programs that reduced opioid administration by 95% in our emergency department. We have worked with partners like the Institute for Family Health, Catholic Charities, and Step One, and many others in this area, all in healthcare, all healthcare providers of different types. But we didn't work with law enforcement in this area at all. Law enforcement saw people who were addicted to opioids and other substances differently than we did. We see them as patients, and they see them, or have seen them, kind of as criminals. So about 3 years ago, which is, we could tell 3 years ago is when the sheriff was elected, we were working on a new program to offer Suboxone in our emergency department, and then transfer the care of patients to longer-term providers that would be able to help them through their treatment and recovery. So Suboxone is a treatment medication that relieves the craving for opioids. Once that craving is relieved, then people can repair their life. They can get back to work. They can repair their relationships. And so we had been told for a long time that the biggest issue was that people couldn't get access to treatment. And so that's why they weren't going into treatment. So we had all of our providers waivered so that they could provide this service to people who we thought would come flocking in. Well, we just showed that we didn't really understand the opioid psychology as well as we might have. And what we discovered is that, in fact, very few people came in on their own, and more would be in our emergency department as a result of overdoses, where they would be Narcan back to life, and we would try to stabilize them. And then most of the time, they really weren't interested in treatment at all. All they really wanted to do is get out of our ER and get their next fix. It's kind of sad. What we did notice is that we were quite successful in helping people that had that had narrowly avoided death consider treatment, but not always get them to enter. So 3 years ago, we enter a new player in the scene, Sheriff Juan Figueroa. Sheriff Figueroa had a completely different vision for the law enforcement role. Instead of arresting criminals who were using illegal drugs, as had been the view from the law enforcement lane, he saw people suffering from addiction, basically the same as we see in healthcare. This is a giant paradigm shift. It cannot be overstated. Juan set up a special team called Oracle to help people suffering from addiction instead of looking for opportunities to arrest them. Completely different paradigm. The obvious synergies of combining our lanes was apparent. Today, Oracle brings patients, not criminals, to our emergency department for care. Our providers and peer counselors work to help these patients make the positive decision to accept Suboxone and start down the treatment path to a brighter future. We arrange care with our partners, and Oracle transports them, because transportation is a very difficult thing, and I'll talk about that a little bit more, to the next step in their recovery. This is totally innovative and refreshing. It's completely different than the way it was. I'd also like to say a few words about Juan Figueroa personally. Juan is a remarkable leader. He walks his talk. There are many officials that do not keep their word. Juan has offered to help us when we have difficulty transferring patients to treatment. In the middle of cold nights with no taxis or other options to help patients get to where they need to go, Juan's department has been instrumental in expanding the role of law enforcement to support their colleagues in healthcare. So we're very grateful for that. Juan is a man of honor, innovation, leadership, execution, that's getting things done. It is difficult to express the magnitude of my admiration for Juan Figueroa. His work has changed the paradigm and role of law enforcement, an absolute leader to embed social workers and counselors into his Oracle team and change the way law enforcement services are delivered here in Ulster County. Sheriff Figueroa's work is a model that is being followed around the country. It was mentioned just moments ago that he will be presenting at a national conference this exact program. We should all be so proud of him and the work he's doing, saving lives and leading the way for a new kind of law enforcement. I thank you for the opportunity to share this with all of you today, because it is just so exciting, the kind of work that our sheriff is doing.